Mental Health Representation in Beautiful Boy, a comprehensive analysis of characters, portrayals, public perception, stigma, stereotypes, and nursing implications while battling addiction.
Character analysis, main characters, and the mental health issues they're dealing with. The film's central characters are David and Nick. In this film, we are given a clear depiction of the strong father-son bond that they share, as well as the mental health struggles each of them faces through the difficulties caused by Nick's addiction. Examples of this can be seen through Nick's struggle with methamphetamine addiction, while David grapples the emotional toll of his son's addiction on both himself and the family. Through Nick's struggles with addiction, we can come to understand the disease course of addiction and the ways in which individuals can be affected by it. Symptoms and behaviors. Nick opens up about his struggles with addiction in the first half of the movie, admitting that they made him feel better than he's ever felt. This allows viewers to understand the emotional turmoil and internal struggles faced by Nick, and can aid in empathy and understanding regarding his struggles with addiction. Nick exhibits withdrawal symptoms, mood swings, and risky behaviors, highlighting the chaotic nature of addiction. David, on the other hand, displays signs of depression and anxiety as he navigates the complexities of addiction's impact on family life. We can see the struggle he faces with the effects of Nick's addiction on his life, and he is looking for answers to help his son. Co-occurring disorders noted. In addition to addiction, Nick's behavior suggests underlying issues such as anxiety and potential trauma, complicating his recovery. Numerous scenes demonstrate Nick experiencing stressful situations and an inability to cope, resulting in him turning to drugs for relief. These co-concurring disorders often accompany substance use disorders, emphasizing the need for comprehensive treatment. Terminology and mental health concepts. Key concepts in this movie include terms such as substance use disorder, withdrawal, sobriety, and relapse, all of which are critical in understanding Nick's journey. These concepts provide a framework to discuss addiction not as a moral failing, but as an incredibly difficult health condition requiring extensive treatment. The impact of mental illness. David's relationship with Nick illustrates the emotional strain of addiction on family bonds. We can see David's unwavering devotion to helping his son and the effect it has on his family life, as expressed through the exhaustion he and his wife experience throughout the film. During a scene where David is meeting with a doctor to understand the brain chemistry of someone dealing with meth addiction, the doctor explains that because of the hyperactivity in the amygdala, which is the part of the brain responsible for feelings of anxiety and fear, and loss of dopamine receptors in a user's brain, it's almost impossible for someone addicted to meth to recover using conventional treatment programs. This demonstrates David's desperation and hope found within familial love amidst the turmoil of substance dependence. Risk factors contributing to mental health struggles. Various risk factors contribute to Nick's addiction, including social, environmental, and biological influences. The film portrays how familial backgrounds and external pressures, whether they're intentional or not, can exacerbate mental health issues and lead to substance use. We gain insight into the possible struggles Nick faced through his parents' divorce, through an interaction between Nick and David, when David refuses to give Nick money and Nick lashes out, saying Mom should have got custody.
The accuracy of portrayal. Evaluation of symptoms depicted. The film thoroughly demonstrates the portrayal of symptoms linked to withdrawal and addiction such as self-isolation, mood swings, and anxiety. It highlights the significant impact of these symptoms on everyday life and family life. Throughout the movie, we see the development of Nick's addiction and the effects it has on aspects of his personal life, including the loss of personal motivation and the destruction of relationships with family members. Some of the behaviors depicted are exaggerated for dramatic effect, such as the emphasis on Nick's father, David's, inner turmoil he experiences. This leads him to use substances in order to better understand the reasoning of his son's addiction. These types of exaggerations can compromise the authenticity of the portrayal of addiction and the effects it has on family dynamics. The balance between realism and drama is crucial in representing addiction accurately. Dramatized elements may misrepresent addiction realities, portraying extreme relapses as moral failures. Such stereotypes risk reinforcing societal biases, leading to misunderstandings about the nature of addiction and the struggle for recovery. Alignment with DSM-5 definitions. Nick's experiences resonate with evidence-based definitions found in the DSM-5, particularly regarding substance use disorders. The DSM-5 is a psychiatric diagnostic tool used by healthcare professionals in the diagnosis and treatment of psychiatric disorders. This alignment strengthens the film's legitimacy in illustrating mental health challenges. This was specifically demonstrated through Nick's ongoing struggles with cravings. This is a new criteria added to the diagnoses of substance use disorders. Later in the film, we see interventions that correlate with what is recommended for the treatment of substance use disorders. Depiction of rehabilitation and therapy. The film portrays rehabilitation, therapy, and medication as interventions to be used when an individual is struggling with substance use disorder. It showcases support groups and treatment discussions for individuals during recovery. While some dramatization exists, it largely reflects current practices recommended by the DSM-5, highlighting the importance of community strength during recovery. Non-linear recovery timeline. Beautiful Boy depicts a non-linear timeline for recovery, although it does not well encapsulate the length of which an addiction and recovery cycle may last. Emphasis was placed on relapses as part of the recovery journey for individuals struggling with substance use disorder. This portrayal aligns with real-world experiences, countering the misconception that recovery follows a straight path. Evidence-based practices. Although the film hints at evidence-based practices like motivational interviewing, these approaches lack depth and exploration. Highlighting effective treatment options such as harm reduction could enhance understanding of comprehensive addiction care.
Impact on public perception. Positive influences. Humanizing addiction as a mental health condition. The film portrays addiction as a complex mental health disorder. It shows Nick as someone who is smart, caring, and talented when sober. During a conversation with Nick, David mentions that not too long ago Nick was reading, writing, and on the water polo team. This highlights that addiction can affect anyone, regardless of background. This challenges stereotypes that label individuals with addiction. By showing Nick's struggle and his family's unwavering support, the film encourages empathy and compassion and can help reduce stigma, potentially motivating the public to view addiction as a treatable condition rather than a personal flaw. Raising awareness about relapse and long-term struggle. By depicting Nick's cycles of sobriety and relapse, the film educates viewers on the chronic nature of addiction. It promotes the understanding that addiction requires ongoing care similar to other long-term illnesses. This may prompt public discussions about prevention and treatment access. David reading about methamphetamine's effects highlights the science behind addiction. This scene informs the audience that addiction is often out of the control of the person who is addicted and that substances can alter the brain physically. Empathy for families affected by addiction. The film really highlights the emotional toll addiction takes on families. By centering on the father's pain and helplessness, the movie gives us insight into the broader impact of mental illness, not just on the individual, but on their loved ones. This can lead to increased awareness and support for families navigating similar challenges. Negative influences. Risk of reinforcing stigma through dramatic portrayals. The focus on Nick's destructive behaviors, such as stealing from family, lying, and disappearing, may reinforce stereotypes that individuals with addiction are dangerous or untrustworthy. Research shows that exaggerated media portrayals can increase public fear and social distance towards those with mental health conditions. Narrow representation of addiction. The film presents addiction as something primarily experienced by privileged individuals who have access to rehab, therapy, or even a doctor. It may obscure the fact that addiction affects people of all backgrounds, including those in poverty or marginalized communities who face systemic barriers to care. This limited perspective could skew public understanding of how widespread and unequal the addiction crisis really is. The film seems to show relapse as a failure and recovery as a return to complete sobriety, when in reality, many people take different paths, and partial progress still matters. Limited portrayal of evidence-based interventions. The film excludes evidence-based interventions like cognitive behavioral therapy, which, according to the American Psychological Association 2017, is a widely accepted research-backed treatment that helps individuals identify triggers, challenge harmful thought patterns, and develop healthier coping strategies. Viewers may then underestimate the complexity of professional intervention or overestimate the role of family support alone. David's attempt to try drugs himself to understand Nick's experience could be misinterpreted as a viable coping strategy, which is risky and would not be recommended. Finally, the film lays out harmful reduction strategies such as needle exchange programs, safe use education, or access to overdose reversing medications like naloxone.
Stigma and nursing implications. Understanding media influence. We live in a media-saturated world where addiction and mental illness are often portrayed as moral failings or signs of instability. These harmful portrayals fuel shame, isolation, and fear, preventing people from seeking help. Many individuals in substance use or mental health disorders hide their struggles or daily treatment, internalizing negative societal messages. In Beautiful Boy, Nick Sheff hides his relapse out of fear and shame despite being bright, talented, and loved. His story shows how self-stigma, social stigma, and structural stigma can create deep inner turmoil and become major barriers to recovery as people fear being reduced to a single, dehumanizing label, addict. Nurses' awareness of media portrayals. As nurses, we are not immune to media bias. If we're not aware of these influences, we risk unconsciously carrying harmful stereotypes into our practices. Understanding media influence helps us reflect on our beliefs and provide trauma-informed, non-judgmental, patient-centered care. Beautiful Boy challenges the junkie stereotype, showing Nick as a whole person, a son, a student, an artist. His father, David, evolves from judgment to understanding, As nurses, we must do the same, seeing patients beyond their diagnosis and practicing with empathy and openness. Correcting misconceptions. Nurses play a vital role in challenging media-driven misconceptions. Addiction is not a choice. It's a chronic health condition shaped by trauma, stress, genetics, and environment. In Beautiful Boy, David's understanding evolves as he realizes Nick's struggle isn't about willpower, but rooted in deep emotional pain and neurochemical dependency. His shift from trying to control and rescue Nick to supporting and educating him reflects how nurses can educate, advocate, and provide compassionate support. By using evidence-based knowledge, nurses can help reduce stigma and empower families. David's writing reminds us of what nurses must do: seek truth, share it, and lead with empathy. Strategies nurses can use in practice. Educating patients and families. Beautiful Boy shows addiction can affect anyone, even those with loving families and bright futures. Nurses can explain how trauma, stress, and social factors like poverty and inequality increases addiction risk and emphasize mental health's role in well-being. Advocating compassionate care. The film highlights addiction's emotional toll on families and caregivers. Nurses should recognize burnout, not blame patients, and provide trauma-informed, patient-centered care that corrects stigma to build trust and healing. Supporting through relapse and recovery. Nick's relapse shows recovery isn't linear. Nurses must offer non-judgmental support, recognize withdrawal signs, and provide resources, understanding relapse is part of many recovery journeys, not failure. Promoting mental health literacy and reducing stigma. Beautiful Boy challenges the notion that addiction is weakness. Nurses can use media and technology to educate and reduce stigma, tailoring information to individual needs. Involving patients in care. Nick often felt excluded from treatment decisions. Nurses should use clear language, listen actively, and offer choices to involve patients, build trust, and improve outcomes.
Stigma. Recognizing stigma helps nurses provide respectful, effective, and trauma-informed care. Beautiful Boy highlights 3 key types of stigma. Self-stigma. Nick internalizes shame and guilt about his addiction, especially during relapse, leading to low self-esteem, isolation, and reluctance to seek help. He avoids asking for support due to fear and blame. Nurses must create safe, non-judgmental environments that encourage honest communication and reduce self-blame. Social stigma. People around Nick struggle to separate him from his addiction, which strains relationships and reflects society's negative labels and attitudes. This alienation affects both the individual and their families. Nurses can help by treating patients with dignity and showing compassion, and actively challenging harmful assumptions and stereotypes. Structural stigma. The film highlights systemic barriers such as limited access to long-term treatment and rigid restrictive healthcare models that delay care until drug use is controlled. These policies cause farther harm and prevent timely support. Nurses must recognize these structural obstacles and advocate for harm reduction, equitable access to care, and patient-centered treatment approaches. The CLPNA outlines essential competencies for LPNs to ensure safe, ethical, and accountable care. Therapeutic communication 2.7. Building trust through empathy and active listening. In Beautiful Boy, David learns that truly listening to Nick strengthens their bond. Nurses must create safe, supportive spaces, especially for vulnerable patients. Professional accountability 1.5 and 1.6. Knowing our limits, reflecting, and learning. David educates himself about addiction, showing how LPNs must continually grow to provide compassionate, evidence-based care. Advocacy 1.9. Speaking up for patients and challenging stigma. David advocates publicly for those affected by addiction. Nurses can promote dignity, correct misinformation, and support trauma-informed care. By applying these competencies, nurses can build trust, improve care, and better support patients, just as David learns in Beautiful Boy. Compassionate care. At the heart of all of this is compassion. Beautiful Boy teaches that recovery isn't linear. Nick's journey is full of relapses, heartbreak, and moments of hope. But what remains constant is his father's love and his own will to try again. As future nurses, we must be that consistent presence. Whether we are correcting a peer's outdated view of addiction or comforting a patient post-relapse, our empathy matters. We are often the first point of contact for people struggling with substance use, and that encounter can shape their willingness to seek care again. When we lead with empathy, challenge stigma, and advocate for trauma-informed care, we are not only supporting recovery, we help rewrite the story of addiction for generations to come. Beautiful Boy reminds us that behind every diagnosis is a life, a family, and a future worth fighting for.